Now the booster programme in the UK is being accelerated. We thought we'd focus some time on your questions about that jab. Thanks for all your questions. To answer them, I'm joined by our regular guest, Dr. Sarah Jarvis, and by the Interim Deputy Chief Medical Officer, Dr. Tim Waite. Welcome to you both. First up, can I just get your reaction to news from South Africa, so-called real-world data, that 2 doses of Pfizer has shown to have 70% protection against hospitalisation with Omicron, the new variant. What is your reaction? Dr. Waite, perhaps if I can start with you.
Well, thank you for having me. The latest real-world data from South Africa, and it must be said the South Africans have been exemplary at sharing their information all the way through this crisis and through the emergence of Omicron. It helps, it adds another piece to the jigsaw, and it's probably in keeping with the information that we're seeing emerging from the vaccine programme here. What they've seen, and I've only read the headlines so far, is that we still have 70% effectiveness against severe disease, and that's in a population group where about a third of the cases were Omicron and about 2/3 were Delta. What we know as well as that is that the vaccine effectiveness against infection, so symptomatic infection, is very much lower. It's 33%, and that's broadly in the same ballpark as the early information we've got here, where we've seen 2 Pfizer jabs having effectiveness of about 20%. What this all adds up to is the importance of getting boosters, getting that 3rd dose, because that really does jump up the effectiveness of your vaccination.
Yeah.
And for people who haven't had dose 1 or dose 2 yet, it's not too late. Please do come forward.
OK, clear message there. Let's bring in Sarah Jarvis then. Lots of people asking the same question. How long after COVID do they have to wait before having that booster? Dr. Jarvis.
At the moment, the recommendation is very clear that it should be 28 days. Now, there are a few reasons for saying that. The first is that your body is still recovering after having COVID, and therefore, once you've got past that 28 days, there's a better chance that your body will be in a good position to mount a new immune response. The second thing to bear in mind is to get vaccinated, you have to go into a vaccine centre. And although later on in that month you may not be infectious, in an early stage you might be. And we really don't want people to come away from the vaccine centre having had both a booster and a dose of COVID infection.
OK, let's go to our next question now. And is it safe to have a booster jab when you are pregnant? Perhaps, Dr. Tom Waite, you can start us off on that one.
So the short answer is yes, we're really encouraging pregnant women to come forward and get vaccinated. There's a huge amount now of real-world evidence of both the effectiveness and of the safety of vaccinations in pregnancy. What there is also is really quite a lot of evidence that what isn't safe in pregnancy is getting infected with COVID. We know that of the pregnant women who are in hospital with COVID, about 98% are unvaccinated, and some of them are ending up in intensive care. A similar proportion of the pregnant women who go into intensive care with COVID are unvaccinated. So in terms of the safety, we know that it's safe for mum, we know that it's safe for the baby. We've looked at outcomes here, and you can see that there is no difference at all in terms of the risk of very, very premature birth or very low weight birth. It's a safe vaccine, and we'd encourage pregnant women particularly, please do come forward for your vaccination.
OK, given what you've just said then and the importance of that, what about somebody who's in a position where they have had their 2nd dose as advised and encouraged, but now they're having to wait? There's that 3-month gap for their booster and they're pregnant right now. What should they do?
So the reason for waiting for 3 months between your 2nd dose and having your booster is because we know that the reason for having boosters is that effectiveness wanes over time, and that waning doesn't start straight away. Your vaccine after 2 doses, particularly against Delta, and Delta is still the dominant variant in many parts of the country and is certainly the dominant variant in terms of people coming into hospital at the moment. That waning happens slowly, so it's absolutely fine to wait for that 3-month interval before having your booster.
Dr. Jarvis, what are you advising pregnant women who are in that position where they don't qualify because of the gap to have the booster yet?
I'm absolutely saying that in those first 3 months, as we've just heard, the antibody levels are going to be high, and there are two sets of immunity, two different kinds of immunity. The first is antibodies, which is largely your body's first line of defence. It stops the virus from getting into the body from the nose and from the throat, because the antibodies come to the spot there and they mop them up. What we know is that those may wane over time, but your longer term immunity, which offers protection against really serious illness, is largely as a result of something called your T cells, and these T killer cells, which actually kill virus-infected cells deeper inside your body. And that is going to last for much longer. So having had 2 doses, if you're within 3 months, it's highly likely you'll be protected both from getting symptomatic COVID and from becoming seriously unwell. Longer after that, the protection against getting ill with COVID or getting infected with COVID is much lower, but you should still have significant protection against severe illness.
OK, very encouraging there. Let's move on to Carol. A question that I think will resonate with a lot of people who were shielding in the original start of the pandemic. She writes, I am one of many people who are immunosuppressed. My first 2 COVID jabs didn't work. I had no antibodies. Carol's had a 3rd dose, but isn't due her booster until January. She is still shielding. What's your advice? She's been told she's not allowed to have a blood test right now to see if the 3rd dose did create antibodies. Dr. Waite, if you can take that, please.
Yes, so the first piece of advice would be certainly to keep that appointment for your 3rd dose when it comes up, and I think you mentioned that's in January. The boosters and vaccines are one part of the puzzle for keeping us all safe at the moment, and it's important that we all think about how we take steps to look after each other. So that's, first of all, if you have symptoms, absolutely you should be staying at home, waiting for a PCR and waiting for the result of that PCR. All of us now have access to a lateral flow device tests, these rapid tests, which weren't around this time last year. Taking those if you're going out, if you're going socialising, if you're going to see friends and family, will help us keep one another safe if you have no symptoms. And then there's the really important stuff about ventilation and wearing masks. That's about how fresh the air is and how we're making sure that we're not breathing out COVID particles into the air unknowingly. All of those are steps that we can take to protect one another as well as to protect ourselves, and that all adds up to the enormous amount of work that the whole British population have been doing and showing remarkable resilience in helping one another right the way over the last 2 years. And it's particularly important that we do that to help protect those who have less overall immunity than others.
OK, let's stick with this idea of risk management then. Roy says, I'm going to see Jane McDonald at Leeds Arena on Sunday. How big is the risk sitting with 12,000 other people? I've had my booster, he writes, and I know everyone has to have a COVID pass and wear masks, but I'm still worried about catching COVID and being isolated over Christmas. Dr. Jarvis, what would you say to him?
Well, I'll be entirely honest. Personally, I was given tickets to the theatre for my birthday. I'm not going. It was due to be this Saturday. I've basically cancelled Christmas. I've cancelled, well, we've got 2 family weddings and birthday parties which have been cancelled because our feeling is that this is just too big a risk to take. Now, you're absolutely right that wearing face coverings and having lateral flow tests does significantly reduce the risk. But, for instance, if you're going to be in the bar where people have taken their face coverings off, the lateral flow tests will certainly reduce the chance of somebody being infectious. They're pretty good at finding out whether people are really infectious, but they're not as good at finding out whether they're infected. So those lateral flow tests must have been taken within the last few hours. So my personal feeling, it's your choice. I'm not doing it. And if people come to me and say, would you do it yourself or do you advise me not to do it? All I can say is, I am choosing not to do it. There are ways that you can reduce the risk. Lateral flow and face coverings will help with that, but people take their face coverings off a lot. People wear them underneath their noses, and unfortunately I'm seeing regularly on public transport that people are just not abiding by them.
OK, thank you for that, Dr. Jarvis. Dr. Waite, I want to get a question to you on school children now. We haven't been told they're going to get a booster, but even if that does come into the plan at a certain time in the future, won't it be too late against Omicron? What's your advice on that one?
Well, we spoke earlier on about the waning immunity, but also the good protection you get against severe disease after dose 1 and dose 2. And for children, I think it's important to bear in mind that they are at overall less risk of the most severe acute consequences of getting COVID infection, going into hospital. So there's a process to go through before we get to a decision about boosters. The steps there are, first of all, the MHRA, that's the Medicine Healthcare Regulatory Agency, will look at any given vaccine and decide on whether or not it is safe and whether it is effective. Once a vaccine or any medication has passed that stage, the JCVI, that's the Joint Committee on Vaccines and Immunisation, it's an expert group, an independent group, will then say what's the best way of deploying this vaccine in the population in order to make sure that it offers the greatest possible level of protection. JCVI will make a decision on whether we should have boosters in people below the age of 18, noting that the current booster programme is focused on those over the age of 18, and then it would be rolled out. But at the moment, the focus in children is very much on those first and second doses, because of course you can't have a booster until that primary course is complete.
OK, just a quick one then to end on with Dr. Sarah Jarvis. Jackie writes, my 25-year-old daughter is a teacher and had her second vaccine 8 months ago. At the time, she was working with a vulnerable child, so had to have it early. She's called 119 and she now can't get the booster, basically. So what's your advice for her? Is it the same thing that she will have a little bit of protection anyway?
She should have protection against severe illness, but she's quite right, 8 months on, that's going to be significantly less. So I would strongly advise that she might want to look around. There are a lot of walk-in centres which are currently offering it, and we know that the availability is going to be ramped up dramatically in the next few days, both through GP-led centres, through pharmacists who are coming online, and through walk-in centres. So try one of those.